So now we know what shoulder impingement syndrome is, the anatomy behind the shoulder, common causes of impingement, and what symptoms you might have if you are experiencing the condition. So what can we do about it? Well, there's pretty good results from conservative treatment. So just go and see your local manual therapist, and they should be able to do a bit of an assessment and have a look what might be causing that impingement, because that's really important. Finding the cause of the impingement helps to dictate the treatment and the rehab which is associated with it. So some things which a manual therapist might do, or a physio or exercise physiologist, will be to probably look at your predisposing factors first. The most common mistake for rehabbing a shoulder is that people get into strengthening too quickly. They start doing these, banded rotations and that kind of thing, trying to strengthen their rotator cuff muscles, which is an important part of the process, maybe, if the rotator cuff is involved. But what it actually does is, if you're activating those muscles actually, they cause compression of the head of the humerus into the ball and socket. So you may actually just be causing further irritation. First of all, what you really want to do is get the mobility back in the shoulder joint first. Then once we've got full movement, pain-free, then we move into our strengthening stage. So manual therapists might look at, first of all, postural stuff. So might need to get all this stuff here, stretch you out through the chest, make sure that your back can extend properly, because if your back can't extend properly, if I try and raise my hands from a hunchback position, makes it really difficult to get all the way up. But if my back's up nice and straight, easy, no troubles whatsoever. So making sure that the chest is back there and back is straight is really important for your shoulder range of motion. And also the strength between the muscles between your shoulder blades and your spine, they are required to hold you back. So once you stretch out through the chest and in this position, you need something to hold you there to prevent you from going back into there. And that's where strengthening up through those muscles can help a lot. You also want to open up the shoulder joint. So try and get it from there down to there, so that all your motions can become much easier. So for that, you want to do mobility exercises, which doesn't actually involve using the muscles which use the shoulder. So we call these kind of passive mobility exercises. After that, once you've got pain-free range of motion, then you can move into the strengthening stage, and depending on what structures are affected, that sort of thing, this will dictate what sort of strengthening exercises your therapist may use. Other options, depending on what's going on in there, cortisone injections can be quite handy to decrease the inflammation and decrease your pain in there. However, it is only a band-aid solution, should be used in conjunction with rehab and fixing up the actual cause of the issue, because your pain might go away and you might feel good, but then once that cortisone wears off, you might be in a little bit of trouble again. If you do think you have shoulder impingement syndrome, go and see your local physio, exercise phys, osteo, chiro, massage therapist, whoever you like.